Every year, more high blood pressure medicine, hyperlipidemia. Oh, you're pre-diabetic this year. And it was just becoming progressively worse, every patient.
If what you're doing is working for you, great. But guess what? It's not. How do your patients feel? They don't feel better. How do they look? They don't look better. How are the numbers? They're not any better. Well, let's add another diabetes medicine. Let's add another cholesterol medicine. Let's add another PCSK9 with a price tag of $15,000 a year to your regimen. And the disease progresses. How is that working out for you? How do your patients feel on those medicines? How do they feel on the statins? Cognitive changes, fatigue, muscle soreness, weakness, increase in blood sugar. Now you have to take a diabetes medicine because your blood sugar is elevated. How do you think the patients feel about that? Patients go to their cardiologist, get put on a statin. That's pretty much it. What else are you doing? What other drugs are you giving you? Well, some blood pressure and diabetes medicines. Okay, perfect. Why? Why do you have high blood pressure, diabetes, and high cholesterol? Visceral fat. How can we get rid of the visceral fat? Well, you got to exercise more, Fred. You got to diet more. That doesn't work either. Look at the trends. Go to the cardiometabolic summit and see what the mortality and cardiovascular disease rate is. No matter what we do, it gets worse exponentially. If you want to learn why those things aren't working and what to do in place of those things, then this course is definitely for you. This most recent study, looking at this PCSK9 inhibitor, along with maximum dose statin, the problem is with the maximum dose statin that they saw no shrinkage in the plaque in any of the studies, no matter how much statin that they used. But with estradiol, all these studies show reduction of carotid intermediate thickness with oral estradiol. What you don't see with the statins, you see with oral estradiol. Strokes, heart attacks are prevented. The plaque buildup in your blood vessels is diminished. When you stop the estrogen, it will build up your plaque, increasing your risk of heart attacks and strokes. Estrogen protects your heart against heart attacks and plaque buildup. The most recent NIH study, the Danish trial, the ELITE study, the CORE, the WEST, the EPAT trial, all of those studies show tremendous benefit when you take estradiol. Not only do you not get the heart attacks, which are reduced, but you can actually reverse the plaque that's in the blood vessels. You say that you're losing your memory? Women that don't take estrogen significantly increase the risk of Alzheimer's disease, 80%. Testosterone, muscle, ligaments, joints, tendons, bones, skin. The best hormone for your bones is testosterone. Nobody goes from minus 3.5 to minus 1.5 DEXA scan. The osteoporosis expert in town just shakes his head when he sees these results because all he uses is biphosphonates. Hormones, look at the results that I've sent you on the DEXA scans. Do you get these results? No, to be honest with you, no, I don't. Well, that's what the courses are about. You start the course on Friday morning. When you leave Sunday afternoon, you'll be able to go home Monday morning and start and do everything. We teach you, as they say, the nuts and bolts. We teach you and show you how to prescribe, monitor, adjust, troubleshoot, and be able to start everything on Monday morning. It's all given to you, and we discuss it and review it so that when you go home Monday morning, you know what to do. Friday morning, you're clueless. Monday morning, you're confident in doing it because as we go through the course on Sunday, it's all case presentation. I present labs, clinical scenarios. You have to answer them, you have to figure it out because these are the most common scenarios that you're going to encounter. So on the forums, it's more of a free-for-all where different physicians will post questions, scenarios, cases, problems. Physicians post these various questions and then we let other physicians answer them. A meeting of the minds to discuss it. I throw in my 2 cents, but it's just not all me. I sort of let everyone else do it. And if there's something that needs to be corrected or that's an issue or that I disagree with, or people that disagree with me, it's a nice open discussion. But I understand because 20 years ago, I was probably in their shoes also. And I would have said no because I used to say no to hormones. I didn't understand them like I do now. I didn't understand the benefits of them until I read about it, until I started doing it and see the results and the outcomes of it.
I'm just family practice, but I've been trained by someone who knows this better than anybody. And if they would come and listen to Neal, I'm convinced that they would change the way they practice.